Conium maculatum, or in English, poison hemlock. One of the oldest cases of the need to deliver bad news, Mellitus condemned Socrates after trial in 399 BC for offenses of corrupting the minds of the youth of Athens and impiety, according to Plato. In this seminar, we will seek to use a modified Socratic method to teach the principles of delivering bad news to patients and their families. Welcome to our educational webinar entitled The Bad News Bearers, an educational webinar for providers. In this Train the Trainer webinar, we will provide first-line care professionals such as nurses, physicians, physician assistants, and advanced practice nurses with the tools required to compassionately and effectively deliver bad news to patients and families in order to help them process the news and organize an effective response and plan for ongoing care and treatment. Strategies include introducing the listener to the importance of delivering bad news and the possible effects when done poorly, such as patient anxiety, unmet goals, and increased risk of malpractice suits. Steps to delivering the bad news are addressed to include preparation of the space, assessing the patient's ability to understand and process information, and determining the appropriate people to be present. Special circumstances to prepare for are addressed, such as young patients and patients with native foreign language. Steps for delivering bad news will include giving warning, being direct, avoiding jargon, and paying special attention to the emotional response from the patient and acknowledging the patient's and family's concerns. By the end of this webinar, you will be better equipped to handle the difficult emotional task of delivering bad news and helping patients and families to process the news and move on to the next step. We are the consultants of West Texas A&M University Consulting Group, an educational consultants group with over 30 years experience in the fields of palliative and direct primary and specialty care of patients and their families. We are all MBA level professionals with experience in residency and fellowship education, clinical medicine, and training for the best practices in the hospital or clinic setting. Our principals that you're going to meet today include Mariah Graham, who is a health information management expert and EHR analyst. Mariah is currently pursuing her MBA at West Texas A&M in order to increase her exposure to teaching opportunities in education, clinical medicine, and training for best practices in the hospital setting. Dr. Dennis Gretsch is an assistant professor of anesthesiology and division chief at a New York City medical school. Since 2009, Dennis has coordinated anesthesia for the International Surgical Health Initiative, or ISHIglobal.org. Dr. Gretsch's research in anesthesiology, global health, and complementary medicine has been presented nationally and internationally. His expertise is in providing patient-centered care to trauma patients and surgical patients. Dr. Mike Laller is a physician executive with special expertise in palliative care and hospice care. Mike is Chief Medical Officer of a healthcare organization in North Carolina. He's Director of Training Programs in Palliative Care and specializes in presenting workshops on dealing with delivering bad news to patients and families. And I'm Glenn Hamilton, a family physician and managed care executive with experience in academic residency education, hospital administration, geriatrics, and managed care. In addition to my work with the WTA AMU Consulting Group, I'm Vice President of Clinical Policy for a national managed Medicaid managed care organization, and I have over 25 years experience in medicine. Our training today on delivering bad news focuses on three primary areas. First, Mariah will discuss the significance of the problem. Then Dennis will talk about specific considerations in delivering bad news. Finally, Mike will use case studies to demonstrate the successful use of these techniques. At this time, let me introduce Mariah Graham for a discussion of the importance and significance of this problem.
Thank you for that introduction, Glenn. I'm going to begin my portion of this webinar with the definition of bad news, which you'll hear multiple times throughout the presentation. So as we share information with you all, I want you to keep this definition in mind. So what is bad news? Bad news is defined as any information which adversely and seriously affects an individual's view of his or her future. Notice that I've placed emphasis on the words adversely and seriously. I say this to point out that when delivering bad news, it must be done effectively and with compassion. You'll learn more about this later in the webinar. So other than the obvious reasons inferred from the definition, why is knowing how to deliver bad news so important? For one, it can be a stressful task. Providers have often described it as hitting the patient over the head or dropping a bomb. With no clear direction on how to go about it, providers tend to stress over how to complete the task. Another reason is that patients simply want the truth. Over the years, studies have been done. One survey in particular revealed that 96% of the people surveyed wanted to be told directly if they had a cancer diagnosis, and 85% of those people wanted to know exactly how long they had to live. Another study showed that 91% of those surveyed wanted to know their chances of being cured, and 94% of those wanted to know the side effects of treatment. Another reason why gaining this skill is so important is because there are ethical and legal implications. As providers, you are legally obligated to provide patients with as much information as they desire regarding their health. Even if you think that it may have a negative impact, you cannot withhold the information. However, this does not mean that you cannot carry out the task with regard or concern for the patient's sensitivity. As a provider, you must still act ethically. Also, you must consider the fact that patients do not comprehend medical information the way that you do. If not delivered properly, the news may seem less or more severe to the patient than what it actually is. Lastly, I want you all to remember that even though this is a very serious moment, it is an opportunity for you to engage with your patient and develop that patient-provider trust. Not knowing how to properly deliver bad news can cause you to disengage emotionally from your patients. So here I have listed some effects of poor and proper disclosure. If bad news is delivered poorly, you can obstruct the well-being of the patient as well as impair their quality of life. It can hinder the patient-provider relationship as well as increase the risk of malpractice suits. Improper delivery can cause the patient to develop feelings of anxiety, mistrust, anger, and even fear. To accompany the mistrust, it can cause the patient to place blame on the provider for any and all outcomes of their health. However, if bad news is delivered properly, you can actually turn all of the negatives listed here into positives. Imagine how you would feel knowing that you are actually adding to the well-being and quality of life of the patient instead of deducting. So in support of this information, I have provided some statistics. There were a few surveys conducted at the annual meeting of the American Society of Clinical Oncology. One survey asked providers how many times on average did they have to break bad news in one given month. The results on the left reveal that 60% broke bad news to patients 5 to 20 times per month, and 14% broke bad news over 20 times per month. The other 26% could not recall. In another survey, providers were asked to identify important stressors of giving bad news to patients. The results on the right indicate that 55% cited how to be honest with the patient and not destroy hope as most important, 25% cited dealing with the patient's emotions as most important, and 10% cited finding the right amount of time as the biggest problem. The other 10% deemed them all as equally important stressors. In another survey, providers were asked how they would rank their ability to deliver bad news. The results here indicate that 53% ranked themselves as being good to very good, 39% thought that their skill was fair, and 8% ranked their skill as poor. As you can see, nearly 50% of providers revealed that they actually need work on improving their skill of delivering bad news. These numbers only reiterate the importance of knowing how to deliver bad news. So now I want to assess what you've learned thus far. I have here a short quiz, but instead of me reading the questions and providing the answers, I want to try a different format. I'll give you all some time to read the questions and discuss the answers with your colleagues. There will be times when you'll need to bounce an idea off of your colleagues before presenting information to the patient. This is a great technique to use and will aid you in developing the skill of delivering bad news. I hope you guys had some great discussions. So now that we've covered the nature of the problem, we'll have Dennis discuss the specifics of training.
Hello, my name is Dr. Dennis Grech. I'm an assistant professor of anesthesiology and perioperative medicine at a New York medical school. I'm here to talk to you today about the skills that are required to compassionately and empathically deliver difficult news to patients and their families. Shall we begin? Before entering the patient's room, it's important to practice and have a role-playing session so you know exactly what type of language you want to use when you speak with your patient and their family. Additionally, it's important to create a nurturing space for the discussion. Any place that's private and free from distractions will do. Everyone should be seated with their cell phones and beepers turned off. It's important to determine who should be present during this conference. Patients may want to be alone, or they can have clergy, friends, family, or other physicians present. It's always important to obtain patient's permission if you, the healthcare worker, wants to have another consultant or social worker present. Be sure that you're very well informed about the patient's medical history to convey confidence in your information that you're disclosing to them today. Patients may have special circumstances, such as suffer from developmental delay. They may be difficult to have competency and consent signed. So it's very important to plan in advance for this. Pediatric patients always have to have their parents present. If they are a ward of the state, then the court order usually has to come from the local jurisdiction saying that they have permission to treat and do surgery on patients. Patients have language barriers. It's important to use hospital-certified translators or bilingual staff. Is the patient pregnant? If so, it may be the best option to deliver the baby or delay treatment until the baby is delivered. In some extreme cases, terminating the baby is the best option for the patient. Of course, cultural groups, it's important to be sensitive to different traditions and regulations or mores with regards to touching members of the opposite sex. It's always important to ask and maybe have a coworker of the opposite sex present with you before speaking with the patient. If the patient is very religious, then a clergy member could be invited as well. If the patient is not competent, then it's important to make sure the person who has the healthcare power of attorney is present for this process as well. When you disclose the bad news to the patient, it's important to greet them and introduce everybody present. Sitting down, like we mentioned earlier, will make everyone feel calm. And it's important to use the nonverbal cues, such as eye contact and your posture, to indicate your attention is being directed at the patient. When you speak, avoid medical terminology and speak in a slow, confident, and kind tone. If the patient starts speaking, of course using active listening skills such as nodding your head, verbal cues when they speak such as I understand, or other hand gestures can help the patient understand that you are connecting to them emotionally, empathically, compassionately, and intellectually. Before you give the patient the bad news, it's important that you assess their understanding of their condition and how much has been disclosed to them. Make an agenda and establish a game plan for follow-up and treatment. Give a warning shot before you give the bad news. It's important to say, unfortunately, I have bad news. This way they get prepared. Say it in context with information that was discussed already. Make it clearly and succinctly understandable. Pay attention to how the patient reacts. Sit in silence and allow the news to sink in. Do not move forward until the patient is ready. If necessary, provide tissue and comfort until they are able to move forward. Clarify any questions they have and invite them to call you or contact you later on the day or the next day to get further information for areas that they have questions on. If they ask you questions about a prognosis, avoid things like, I don't know. Use generally accepted outcome studies to determine if the patient has a few days, few weeks, months, or years. Also, it's important to assess their personal goals. Would they like to start treatment immediately, or do they have something in their lives they would like to perform before starting treatment or having surgery? This is hard on everybody, and physicians and providers are not excluded. Invariably, strong emotions are going to be provoked during bad news. So it's important to utilize these skills.
My name is Michael Laylor. This section of the webinar will focus on techniques to help you deliver bad news. First, what is bad news? Bad news is defined as any information that adversely and seriously affects an individual's view of his or her future. Anytime you have to deliver bad news to a patient, it may be helpful to refer to the following framework. The acronym used to help you deliver bad news to a patient is known as the SPIKES protocol. SPIKES stands for setting, perception, invitation, knowledge, empathy, and summary. The first step is to arrange for an appropriate setting to deliver the news. Find a quiet, private location. Privacy will provide the safety needed to allow your patient to ask important questions. Place a box of tissues in the room. This can help preserve the patient's dignity if tears are shed. Finally, turn off all electronic devices such as phones or televisions. When preparing to deliver the news, remember that your body language will be important. Sit squarely facing the patient. Assume a relaxed body posture, maintain eye contact, and lean towards the patient. In the next step, you assess the patient's perception of their illness. Asking what the patient already understands can provide an important window into the patient's perspective. Questions such as, tell me what you know about your illness, or what have the doctors told you so far, can help guide your conversation, particularly if you're meeting the patient for the first time. Start to look for emotional clues and recognize that this step may not be necessary if you already know the patient well. Next, ask for an invitation to share the news. While this step may seem unnecessary, it is a way to allow the patient to shape how the serious news is discussed. Asking, are you ready to talk about this? Gives the patient a bit of control and establishes that you want to work cooperatively. Also, it's helpful to determine how the patient would like to receive information. Asking, how would you like me to discuss the information with your family, may help you avoid a cultural misunderstanding. When delivering the actual news, do so in a straightforward manner. Consider using a brief statement that allows the patients to brace themselves for the negative news. For example, I'm afraid I have bad news to discuss with you. After your warning statement, provide the news in a manner that can be immediately understood by the patient. Speak slowly and provide information in small bits. Avoid medical terminology, as this may force the patient to struggle to understand the news. The resulting frustration may increase the patient's distress. The more you can present the information using terms the patient understands, the more straightforward you will appear. Brief examples may include, your cancer has spread to your lungs, or your infection is getting worse despite your treatment. After delivering the news, sit quietly and allow the patient to respond. Next, respond to the patient's emotion. You will likely notice a wave of emotion that follows the news. This will not end until long after the visit is over. Your job is to notice the emotion, give it some space, and recognize it will influence the discussion that follows. Acknowledging the patient's emotions will not make them go away, but responding to the patient's fear, anger, or numbness may provide a human dimension to a medical discussion, demonstrating that you care for the whole person. When responding to emotion, empathetic statements such as, "I know this is not what you hoped to hear today," or "I can see how upsetting this is," can be very helpful. Continue to respond to the patient's emotions. A patient may tell you when they're ready to move on by asking, "Okay, what comes next?" Other times you have to gauge if it's okay to proceed. If the patient responds with more emotion, continue to respond empathetically before proceeding. Finally, summarize the plan. At the end of the visit, be sure to summarize what you have discussed and describe the next steps the patient will need to take. If possible, provide a brief written outline of the visit, which may be very helpful to the patient and family later. Now, a brief quiz to check your understanding of the delivery of bad news. Which acronym is useful in delivering bad news? Spokes, spiders, spikes, or spuds? The SPIKES protocol is helpful in delivering bad news. SPIKES stands for setting, perception, invitation, knowledge, empathy, and summary. How long should you respond to a patient's emotions? As little time as it takes for the patient to get over it? Until the patient is in a better position to hear additional information? Until your next appointment arrives? Or until you get a new email on your phone? Wait until the patient is in a better position to hear additional information. Thank you for participating in this educational webinar on how to deliver bad news.
Thanks, Mike. To conclude, we hope you have gained from this presentation and learned a bit about how to give bad news. We hope this webinar has provided the basics to approaching this difficult task for the benefit of patients and their families. There is no substitute for communication and caring on the part of the provider. As you gain experience, you will find an increasing level of comfort with undertaking these kinds of discussions, and the relationships you develop with your patients will provide you with additional confidence about your abilities and about the importance of this task. This webinar should be seen as a start on the path to increasing comfort with such difficult subjects. In order to master these techniques, you must practice and refine them in accordance with your own style with patients. To review, we began with Mariah outlining the scope of the training problem and some of the consequences of good and poor disclosure techniques. Then Dennis described in detail some of the fine points of sharing bad news, including the setting, attendees, and approach to using patient cues, such as body language, cultural references, and attention to special situations. Then Mike demonstrated the practical considerations of sharing bad news with patients using case studies. The take-home point of today's webinar is to pay attention to the special needs of patients and their families in time of crisis. Just as you would not perform a surgical procedure without training and practice, The mental and emotional needs of the patient require just as much attention when delivering bad news and are especially critical to the next phase of the patient's journey, when they must gather their resources to deal with an unexpected setback. Your training and practice will improve the patient's experiences and outcomes. Your support and expertise can make the difference between success and failure as the patient faces perhaps the biggest challenge of their life. You are their lifeline, so be sure you come prepared. Thank you very much.